Hello everyone, I'm Dr. Peters from Starmed Medical Education Programs, and today I'll be talking to you about breastfeeding counseling for the NAC OSCE in this video. So let's start. So before we start off, I should emphasize that this video is intended for educational purposes only, and the content that's presented in this video is not meant to replace any professional medical advice, diagnosis, or treatment. So how can breastfeeding present for the NAC OSCE? So it can present in various scenarios. So mainly it will be a counseling station that will be for the whole of 11 minutes. So there will be most probably be no post-encounter questions. So you will have to counsel the SP or the standardized patient for the whole of 11 minutes. So breastfeeding cases can present if as a pregnant mother. So it can present as inverted nipple, flat nipple, things like that. And the mother is concerned that she's having small breasts and she's scared that she might be unable to give adequate nutrition to her baby through breastfeeding. And the mother may be on medications such as HIV, chemotherapy, radiotherapy, which are considered as contraindications to breastfeeding. And breastfeeding and work can also present as a case scenario which is related to breastfeeding. So the mother is willing to go to work after giving birth, after some time of giving birth to her baby. So breastfeeding can present as these case scenarios, and even it can present as the standardized patient can be a mother who comes after the delivery. So she may complain of inadequate milk supply, breast engorgement, and contraception and breastfeeding. She may come for your advice seeking for contraception. So as I mentioned earlier, there will be information at the door, and most probably the whole station will be a counseling station for 11 minutes, and you will be asked to address the patient's concerns. So how should you start such a station? So you should knock on the door, enter, start by introducing yourself. So say hello, I'm Dr. So-and-so. May I confirm your name and age, please? And before you start off with the conversation, you should ask how the patient is willing to be addressed. So how would you like me to address you? Because that will show that you're concerned about the patient, and so it will be appropriate to the situation. And before you proceed with the discussion, you should always assure the mother that whatever you discuss will be confidential between the two of you unless otherwise required by law. And you should start off by asking the mother, what are your concerns and what brought you in today? Something like that. An open-ended question would be the most suitable one. So the mother will come up with the complaint that she's not having enough milk, feeling sad or overwhelmed after giving birth, feeling tired, or maybe she might just say that she is willing to give birth to her baby and she wants to discuss with you regarding breastfeeding. So that may also be the case. And if there is some presenting complaints such as feeling sad, feeling overwhelmed, or feeling tired, you should always ask about the OCD questions. So that is the onset, course, and the duration of the presenting complaint. If the patient is a new mother, you should always congratulate the mother and show empathy throughout your conversation. So before you proceed with the counseling, before you start to give any information to the mother, you should know some details about the patient and you should start off with some history. So first you should obtain a history about the past pregnancies, present pregnancy, and the delivery. So not in an elaborate way, but you should ask the most cardinal questions. For example, if you are talking about past pregnancies, you should start off with which pregnancy is this? If this is not the first pregnancy, how many kids do you have? What are their ages? Were they breastfed? for how long were they breastfed, and any other issue that you have encountered with the previous pregnancies with related to breastfeeding or any other issues. And you should also ask about any problems they faced after giving their birth, such as yellowish discoloration in the babies or any infections, maybe any neonatal intensive care unit admissions, anything related to that. And then you should move on to the current pregnancy and ask about any problems encountered during the present pregnancy. You should specifically ask whether the mother was screened for HIV and sexually transmitted infections, whether the mother has any medical condition or she's on any medication, because that is highly related to breastfeeding. And then you can move on to the delivery. So what is the expected mode of delivery? Have you discussed about this with your obstetrician? If the mother has delivered or is willing to deliver the baby through a cesarean section, what was the reason for that? So any postpartum complications in the mother after giving birth to the baby. And you should ask about the baby as well. What was the birth weight? Any issues with the baby? Any admissions to the neonatal intensive care unit? Any fever or yellowish discoloration in the baby? And next, the most important thing is inquiring about the present status of the mother and the baby. So first you should ask about the current status of the baby. Is the baby exclusively breastfed? Is he or she on any formula milk? How often is the baby fed? How long do you feed from one breast? And for how long does the baby sleep after a feed? How is the activity of the baby like? So is he sleeping more often? So usually newborn babies will sleep most of the day, but when they're awake, are they active? Are they moving around? Are they moving their hands and feet? Things like that. Are their eyes wide open? The number of wet diapers, it should be more than 6 a day. And the number of stools. And how is the color and consistency of the stool? Any yellowish discoloration in the skin? Any lethargy or reduced activity in the baby, as I mentioned earlier. And in the mother, you should ask about her feelings. How do you feel? How is your mood? How is your interest? So if she comes up and says that she is in a low mood and she doesn't have interest, she doesn't find interest in the activities that as she used to be, you should inquire more about that. So you should exclude depression and ask the other screening questions which are related to depression. So those are, you should ask about psychosis, how is her appetite, how is her sleep. And sleep is very important in breastfeeding because most probably these will be new mothers and they will be sleep deprived all the time, most probably. And you should ask about any suicidal ideas and the energy level, concentration, and ideas of guilt. So those are the things that you should ask to rule out depression. And you should also ask about the thoughts about the baby. So how do you feel about giving birth? How do you feel about becoming a mother? Are you happy about that? Are you worried? So things like that. Any stresses that bothers her? Are you getting enough sleep or rest? So any fever, chills, any pain anywhere, she may be having pain in the breast. If she underwent a cesarean section, she may be having pain in the scar or in the episiotomy wound. So you should ask about that. And at the same time, you should also ask about breast engorgement, lumps, and any redness in the breasts. So any past illnesses such as diabetes, high blood pressure, any psychiatric conditions, any medication she's on, as I mentioned earlier, any chemotherapy, radiotherapy, antiretroviral therapy, contraception. You should ask about contraception because if the patient did take combined oral contraceptives before pregnancy, and she might start taking that combined oral contraceptives just after giving birth, but it can reduce the milk supply of the mother. So you should ask about contraception. any allergies, and smoking, alcohol, and the use of drugs in the mother. So what are the other relevant information? It's very important to ask who else is at home. Do you have other kids? Is your husband with you? How are you coping with the situation? Do you feel overwhelmed? Is there any support available? Is there any family, friends around? Do they come and help you? You should also ask about their financial status. How do you support yourself financially? Are you stable? Are you planning to go to work? And if she's planning to go to work, are you on maternity leave? And when will you be going to work? You should ask about that as well. Then you can move on to discussing about breastfeeding. So to start off with, you can mention the benefits of breastfeeding. You can mention it to the mother that breastfeeding is the best nutrition that can be given to your baby, because the constituents of breast milk really suits the age and the needs of your baby, and it's the best sort of nutrition and the best recommended nutrition that you can provide your baby with. And you can just mention there are several benefits of breastfeeding to the baby and to yourself as well. To the baby, it provides immunity, especially the colostrum, which is the first part of milk that is first breast milk that is ejected in the first few hours after giving birth. That is the yellowish color thin milk that is secreted. So it gives the baby immunity because it has many antibodies and helps the baby to fight with germs. And it provides nutrition, just the right amount and the proportion of nutrients, and it increases the bonding between the mother and the baby. And you can also mention that there is proven evidence that the breastfed babies have a higher IQ than those who are fed with formula feeds. And there is low chance of the baby developing conditions such as diabetes mellitus, obesity when they're adults. And there is also a very low chance of allergies and the child developing asthma when he or she grows up. And when we look at the mother on the other side, it provides contraception for some time, but the mother should be exclusively breastfeeding for that, and the mother should not have yet got her periods back for this contraception to work. So you can advise that it is just for some time until you exclusively breastfeed for the baby, like 2-3 months. So it gives some contraceptive benefit as well. And it protects the mother from cancer, specifically the breast and ovarian cancer, and it helps with the weight loss, and it's clean, convenient, and there is no cost. So the mother will ask some questions. So for how long should I breastfeed my baby? So it is recommended that the baby should be exclusively breastfed for 6 months. But if there is some concern regarding the growth of the child, complementary feeding or solid food can be started around 4 to 6 months. So you can mention that I can give you a pamphlet with all these details, but you should start vitamin D drops just after giving birth, because there is not enough vitamin D for the baby in your breast milk. But until the baby turns 4 to 6 months, there is enough iron in our breast milk, but you should start supplementing the baby with iron after she is 4 to 6 months of age. And if the mother presents with conditions such as breast engorgement, you should advise the mother not to stop breastfeeding from that side. And you can advise the mother to express breast milk and use a breast pump, and use cold compression just after she finishes expressing from that breast or feeding the baby. If the mother presents with a condition such as mastitis or breast abscess, you should advise the mother not to stop breastfeeding, and if needed, you can say antibiotics will be given to the mother. Breastfeeding and contraception. If the mother is on combined oral contraceptives, advise the mother on stopping and changing to another method, such as progesterone-only pills or intrauterine contraceptive device. Breastfeeding and working mothers. Working mothers can exclusively breastfeed their babies without any issue. So you can advise on storing breast milk, express breast milk, and if it's kept in the room temperature, you can keep it for 3 to 4 hours. If it's in the refrigerator, it's for 24 hours, and you can keep express breast milk in the freezer for months. So if the mother is planning to move for a long time, maybe fly abroad, so the mother can freeze her breast milk. But if she's going for that option, you should advise the mother to label the packs of breast milk so that the ones that are the older ones can be used for the baby first. Okay, and other advices. If the mother is drinking alcohol or smoking, you should advise the mother to stop alcohol and smoking during breastfeeding because it's harmful for the baby. You should also advise the mother not to take any medication without consulting a doctor, and when you go to the doctor, just mention to the doctor that you're breastfeeding. At the end, always ask, did you understand what I said? Do you have any concerns? Do you have any other questions? Do you want me to explain again? You should clarify with the patient, and it should be a two-way conversation rather than a session of advising. So I hope you got a clear idea about breastfeeding, how you should face an OSCE station with regard to breastfeeding. So I wish you very good luck for your NAC OSCE exam. Thank you.